Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD. I'm talking to our health officer, Dr. Kevin Michaels. Dr. Michaels, welcome to Wellness Wednesday.
Yeah, thank you for taking the time to interview me this afternoon.
Now, we are right in the middle of National Public Health Week, and the theme this week is Ready, Set, Action. So, what does that mean?
Well, the ready, set, action is broken down into three parts. The first part, the ready part, is all the accomplishments that the health department has made for us since 1816. All the things that we've accomplished along the way. That's the ready piece. The set piece, that are all the training, the procedures, the steps that go into doing what we do. So you got the accomplishments. We're ready to do the what we're told to do from a public health perspective, and the go or the action part is what we're doing today, recognizing National Public Health Week. And it shouldn't be just a week. It's we touch everybody all the time. So it's really important. It's that call that you hear at games. Ready, set, action. So that's sort of the mantra for our organization this week.
No, you're right. It should be it is for all of us. This is our career. It's all year long. So we're just focusing just on this week with this theme. So why is this week so important?
It's to recognize the hard work that those people who have dedicated their life towards the service of public health, it's recognizing all the work they do throughout the year and basically say thank you to them for what they do in enhancing the community, developing the communities, making the communities more resilient, safer from an environmental, from a food safety sanitation perspective, towards the outreach programs to reach out to communities or populations that are in need.
All the things that happen behind the scenes that no one even knows about. It just gets
Exactly.
done. Yeah.
Exactly. We work in the background.
So there's a distinction between public health and healthcare. So maybe people don't know what's the difference between public health and healthcare.
Well, that's a great question, and it's really important. And a lot of people look at it from different perspectives. Public health, when you look at this, the science and art of what we do in the health department, is public health. That's one aspect of public health. But public health has a bigger picture in in looking at all the services people receive for health care, from hospitalization, visits, primary care, urgent care visits. All that could be locked under public health. But really, when you get down to it, public health, what we do at the health department is public health. We're taking care of the community. We are making sure the community has safe food, safe water, safe air. We're looking at the disease trends. We're not focusing on an individual person, but looking at all of the numbers that make up that community's vital signs. So that's public health. Healthcare is that when you are sick or when you go to see your primary care physician or your provider, it's one on one. You're going to see a doctor. The doctor is going to address your healthcare needs as an individual. All right. So I go and the doctor looks at my blood pressure and says, hey, your blood pressure is too high. Or he orders lab work and says, well, hey, your cholesterol's too high. We need to do this. That's healthcare for the individual. That's what everybody should be getting on a given day. Hey, I'm sick. I go to my doctor. My doctor may prescribe medications for me to make me better, to address my chronic disease. All right. That's healthcare. Public health is, when I go out and out and about and I go to a restaurant to have a meal and there'll be a food score there. That's what public health is making sure that when I eat or people eat at an establishment, that establishment is providing the basic sanitation, basic food sanitation and service requirements to provide a safe meal to me. It may not be the best food for my chronic illnesses, but at least it's safe and not going to make me sick from a foodborne illness perspective. That's
Hmm.
one aspect of public health. The other aspect, the big things for Mobile County is our vector control. We go out and we control mosquitoes for the community. It's not an individual, it's for the community we're addressing it. So people don't want to get bit by mosquitoes. So we're addressing more on the global, the community, larger than a family. That's public health. Whereas healthcare is one-on-one with a provider.
Hmm.
So that's really the difference between the two.
Services for many and services for one.
Exactly. And they're
Yeah.
both important. And they're
Hmm.
both important pieces of healthcare and public health is that you're taking care of me individually, but also the community is taking care of me to make sure I'm living in a safe community.
Now, I want to jump back a little bit a few years. We had this little pandemic that went around called COVID-19. It's going to be studied for a very long time in the public health response during the pandemic. And, public health kind of took a beating a little bit during that time,
Mm-hmm.
and the public health response. So, um, why is public health so important today? Now, we already know what people said about public health back during that period of time a few years ago, but why is it so vital in today's society?
Well, we made decisions in public health during COVID-19. We made some public health decisions. Some of them were mandated from on high based on elected officials. Some of them were created at the local level. Those lessons learned, we need to incorporate those lessons learned to address the next pandemic or the next public health emergency. All right. Yeah, there were some decisions made that were not very acceptable to the average individual. All right. I understand that. I think the entire public health community understands that. All right. But that was dealing with an unknown. We did not know what COVID was going to do or not do. But we knew that COVID-19, the illness, was causing a large number of people to become ill, hospitalized, and even die from. I had family members that died from COVID. All right, not here in the immediate community, but in other communities around the United States. And decisions were made, right or wrong, the decisions were made to preserve the community, to make sure when somebody goes to the hospital and needs to be hospitalized, that there are beds available for them. And so those are actions or things that were put in place to maintain the healthcare infrastructure so that when people need to be hospitalized, they were hospitalized. When people need to go to ER, they go to the ER. All right. We wanted to stop transmission. All right. The best we knew at the time, it was spread by air from a person and they're breathing out, and those particles were infecting other people. That's what we knew in the beginning. Now, as time went through and we experienced, COVID-19, 2019, 20, 21, as we moved through, we got a better understanding of the science, what was involved. Did the face mask make a difference? Well, I think the face mask did make a difference in that it reminded people of social distancing. It reminded people to wash their hands. But those same strategies are lessons learned. People are not doing the things we did to control the spread of COVID early on. And that impacts, so those are lessons learned. We emphasize some important personal protective measures that if you're sick, stay at home. Mm-hmm. Re-emphasize cough or sneeze etiquette. Emphasize washing hands, not touching the face after you touch other things. All those things were important. We learned that through the COVID 19. Now, wearing of masks, closing businesses, at the time, it may have seemed the right thing, but after looking at what it did, there could be an assessment that maybe it wasn't completely appropriate. But the best recommendation at the time, we make a recommendation. We assess on the public health side, we assess whether that public health measure, countermeasure, is effective. And if it's effective, then we have data to support it. If it's not effective, we adjust from there. There are consequences. You close a business, people lose, money coming in from that business. Businesses went out of business. That was an impact. So yes, we made some decisions. We took a beating from some of those decisions because people did not understand the bigger picture. We were really trying to save lives, and I think we did. We got a great vaccine. We implemented a vaccine program. Okay, the vaccine may not have been fully accepted by everybody in the community, but it's an effective vaccine that mitigates how people are exposed to the next COVID virus. And maybe their symptoms won't be as severe as previous. Maybe they will not die from the illness. Today, even though COVID is, all intents and purposes, over, we still have a vaccine. We still are seeing a fair number of people being hospitalized, not at the numbers we had back in 2020, 2021, not at those numbers, but we still see people due to other health problems are being hospitalized due to COVID. So yeah, you can beat us up for it, but where we are today, we are stronger and more resilient as a community. So it's
You're
important
right.
to
Yeah.
recognize that.
hmm And like I mentioned earlier, also too, the whole response. This it's going to be studied for several years, and only good things will come about from the studies and everything else from the public health response. Now
The lessons
earlier,
learned, yes.
yeah, lessons learned. Now earlier you talked about some of the other departments that we have, like you talked about, vector control with mosquitoes and things like that. So, can you talk about some of those other public health departments? Other than the ones you mentioned, or if you want to talk about those again, that's okay too.
Well, we have a rather robust outreach programs in different areas as far as the Healthy Start Enhanced program, um, teenage pregnancy prevention, lead, lead abatement or lead control. We have a large number of homes in our community that were built during a time where lead paint was actually used. And we recognize now as we move forward, as people go through the renovation process, that they're renovating, there is lead in the paint. And if they have kids, kids sometimes will touch the paint or touch the dust, and now they start ingesting lead, and that has health consequences to their development. And so we have outreach programs dealing with the environmental lead, the renovation process, the teenage pregnancy. We also have the WIC program, identifying those people at a certain income level, make sure that they get the appropriate benefits if they're pregnant, breastfeeding. They have young kids. They get the right nutrition to set them up for success in the future. A child that eats well, develops appropriately, will tend to do better in school. And so having these early intervention programs, such as the lead, the WIC program, ensures that the child is going to develop and move in a positive direction through school. So those are
Yeah,
some of
very,
our
yeah.
outreach programs.
hmm Yeah, and those will help children reach those milestones that they need to reach at
Exactly,
an
the
early age.
milestones. And we
So,
also have
yeah.
We
Yeah.
also have our prevention and wellness kiosks out in the community. So we have these kiosks out there
Mhm.
that a person can go up to the machine, a big soda machine, green, put in some basic demographic information, and the machine will dispense a Narcan or naloxone rescue kit for them. If they're dealing with either themselves or somebody else with opioid substance use, some drug testing strips, gun locks, and also condoms. So they can dispense any one of those. Now, I say put in some basic demographic, basic information. All it is just going, hey, listen, what gender are you, your age, and ask those basic information. And then, importantly, if they want to be contacted because they want to talk to somebody, they can put their information in, and then we can go back and we can contact them to see what additional services we can provide to them. But as a whole, it's providing them access to Narcan, gun locks, and condoms from
Mhm.
that standpoint. Another great program out there to address the substance use in our community. And so
Yeah.
then the other piece we put out there on a regular basis, not only through the Wellness Wednesday programs, but we put out a whole series of press releases on different topics, reminding the community that hey, there are programs out there, rabies control for your pets, your 4 footed loved ones, addressing rabies prevention.
Mhm.
Um, so we put out a whole wealth of public service announcements to generate interest in the community, to somebody come back and ask further questions or take it as a learning point, going, okay, good, I wasn't aware of that. We had a case of this disease in the community, and it was probably due to poorly prepared seafood. So I need to, next time I serve seafood, I need to make sure it's cooked thoroughly. So all those are things of
Mhm.
importance.
Now you mentioned also too, you go into a restaurant, you go inside the door, publicly posted right there is the sign that's got the number on it. That's something else that we did, and not too long ago, those same inspectors going out there Mardi Gras, all the food that's sold there, all the street food and everything. So, that's yet another aspect that we cover as well, right?
Yeah, we rolled out of this past Mardi Gras. It was great. It was a great event. I think we had, well over 1 million visitors to the city of Mobile, or really across Mobile County during Mardi Gras. And when we look at our numbers, we did not see anything unusual as far as any type of foodborne illnesses. Yeah, people got sick, but not anything where we can point and say, hey, it's this particular food vendor or this particular restaurant. And
Hmm.
so that really gives the strength and the credibility and the professionalism of my food safety inspectors going out, that they were doing their job. They worked in the background. They made sure that each of the businesses were living up to those standards in a meaningful way, that they were providing a safe product to the community, and we were not seeing that on the part of illness showing up in the ER.
Hmm.
We're also, that's on the food sanitation side of the house. So they're doing a great thing. They're going out, not during Mardi Gras, but they're going out and they're getting ready to start inspecting the pools to make sure the pools are safe, so
Hmm.
that when you go to that community pool, you can swim and not worry about getting a illness from the pool. So
Hmm.
we're going out and maintaining those those venues, and we're also looking at other things: tattoo parlors, piercing parlors for those people that get tattoos, making sure that the services they receive are safe from that standpoint. So we're doing a lot of wonderful things that people really don't know or don't appreciate is happening in the background.
Hmm.
They sometimes don't understand that number posted on the door, or when they walk into the business, that it says, they have a score, they have a health permit, um, they may not fully appreciate what goes into earning that permit and maintaining that score.
Mm-hmm.
Now, perfect score is 100. Anything less than 100, you got something wrong.
Mm-hmm.
So, a restaurant that has an 85, could have had 100. And you might want to look at why they got an 85 or why they're really down low. Those are important things for people to understand.
Mm-hmm.
They're still open, they're still serving, but they need to understand what went into that score.
And it's good to mention about the score because all of those scores are compiled and they're all publicly available on our website, mchd.org. And that's all the restaurant ratings. So if you're curious before you go out on that date night, you can
Download
go
the
to
app behind you. Bend your head over
yeah,
the way
yeah,
to show that app.
yeah, yeah,
You
yeah,
can
yeah.
get
You
you can
can,
go to
yeah,
that
right
app.
there.
Yeah,
Yeah.
you can go to that app and you can look at, for most purposes, the most recent food score for that restaurant. So if you're looking
Hmm.
for a good restaurant that, scoring 100, you go out there and you can find them. It's historical, so it may have restaurants that were here yesterday but are not here today. But, again, it's looking at, you know, it's a historical record of that. And while we're speaking on the app, you know,
Hmm.
we have a very, very strong vector control program where we go out and control mosquitoes in the environment. And, sometimes people think of it as spraying. Sometimes we're baiting for larvicides in the water. We're putting out bait fish. We're doing all different things. But the other critical component of it is you as an individual can turn around and go on the app and put in a work request because you feel that the mosquitoes around your house or around your area of play outside is out of control. We will come out there, assess the environment, and determine what's the best way to control the mosquitoes. Is it spraying, or is it environmental mitigation and dumping standing water or that type of thing, or is it baits, larvicidal baits? So we'll come out and we'll assist in controlling mosquitoes. So another important piece of the app, as well as a listing of all the services that the health department as well as family health provides to the community. So it's a one stop for everything.
It is, and I was going to mention it, but I'm glad you talked about it. It's over my shoulder right there. Is there anything else that you would like to mention to the public about National Public Health Week?
Well, hopefully people can sense my excitement of what I talked about. It's all these things you take for granted, where it's just occurring in the community, and they're really important. So I didn't mention the epidemiologists, the nurses, the sanitation inspectors, the vector control inspectors. There's a wealth of people that the list is numerous that I can't include, but those people, really are important. A special thanks from me as the health officer representing Mobile County Health Department. And it's not just in our county, but all the 66 other counties across the state. All the county health departments are all doing very similar activities to ensure that whether you go from Mobile County to Okefenokee County, in Wyoming, that you're you're receiving safe, you're in a safe environment. Food inspections, it's safe because we touch everybody in a given day.
Hmm.
There's not a person that stops at a gas station, gets a drink, gets a coffee, gets a donut, or even going out to lunch, dinner, breakfast. We touch everybody in a meaningful way. And that's really the recognition that the National Public Health Week is doing, is to recognize all the hard work that goes into supporting the public health structure in the United States. And as we change, we're moving from not only from a acute illness, but more to a chronic illness and making sure people who have high blood pressure have access to the appropriate services to control their blood pressure, their high blood sugar, their cancers. So public health is taking on a greater and greater mission across the community. So
Well, I
I
appreciate you
covered a lot.
being,
So
yeah, you
thank you.
did. You did. I appreciate you being on here. And the theme again is ready, set, action. Mobile County Health Department, we're working for you. And we are putting all of those things that Dr. Michael spoke about into action, not just this week, but every single day of the week for you. So, Dr. Michaels, thank you for being on Wellness Wednesday.
Thank you.